Hey everybody, I am live here this afternoon with Dr. Tom O'Brien. Hello, sir.
Hello, Dr. Chat. Nice to see you.
Hey, good to see you. Thanks so much for being here. Dr. Tom O'Brien, for people that don't know, he is the author of two great books, The Autoimmune Fix and You Can Fix Your Brain. This book was very eye-opening for me. So I know we have a lot of brain folks out there, so I highly recommend checking out both. But this is a great one too. He also created the Gluten Summit, as well as went around and interviewed like 85 experts regarding gluten autoimmune disease. And then that's called the Betrayal docuseries, right?
Correct.
And he's the man, so I'm going to let him take over. We could talk about him all day, but thanks so much for being here, Doc. And he's down in Costa Rica enjoying life, so take it away, sir.
Oh, thank you so much. I wasn't prepared to take it away.
Well, we're gonna be talking about brain health and immune health, and you're the expert. So, what?
If I may, then, okay, let's start there. If people Google depression and inflammation, you'll see all the studies that come up that say a mechanism that is primary in the development of depression is that the brain's inflamed. There's inflammation in the brain. If you Google anxiety and inflammation, you'll see the studies, just study after study after study. If you Google schizophrenia and inflammation, study after study after study. If you Google Alzheimer's and inflammation, my point is every brain deterioration disease that I know of, except for one, is triggered by inflammation in the brain and fueled by inflammation in the brain. So if we understand that, then a logical question is not how do I get rid of my depression, but rather why is my brain inflamed? And if you ask from that perspective of why am I inflamed, then you start investigating and you find out, oh, really? I didn't know that that food was a problem for me. Or, oh, really? I didn't know that that little bit of mold in the shower that I get every day when I'm in the shower and breathing in that mold could be inflaming my brain. Or, oh, really? I didn't know that nail polish leaches phthalates into my bloodstream in 3 to 5 minutes, and phthalates can cause inflammation in the brain. Or, oh, really? I didn't know that the lid on my coffee cup, when I get my coffee to go, that the steam from the hot liquid comes up, hits the underside of the lid, condenses, and drops back down in the coffee full of phthalates. And then I drink the coffee and the hot liquid hits the underside of the lid, tapers down into the opening full of phthalates, and phthalates inhibit my brain, causing inflammation. In other words, you start learning that there are many triggers in our everyday lifestyle that fuel the inflammation in the brain, and that it's that fueling of inflammation in the brain that causes your symptoms, whatever your genetic vulnerability is, whether it's depression or anxiety or brain fog or whatever the symptoms are. They're inflammation symptoms, not brain symptoms. That's just where it's manifesting. So the concept is to understand that there's a map, and you're at this point on the map. I'm in depression. I'm on that point of the map. Well, what do I take so that I don't feel depression? You may need some pharmaceutical or some nutraceutical for a short period of time, but it's not a deficiency of that medication or that nutrition that's caused the problem. If there's a deficiency of N-acetylcysteine, there's a reason why there's a deficiency of N-acetylcysteine somewhere else, right? There's a mechanism for why this is happening. So you're at this point of the map and you say, well, I want to be over here. I want to be with no depression. So how do I get from here to here? You have to identify what is the gasoline on the fire in your system right now. That's what you have to identify. And that is the process of investigating why I have the symptoms I have, as opposed to how do I get rid of the symptoms I have? Because you can't get rid of the symptoms. You can put a lid on a pressure cooker. That'll work for a while. It'll work, you know, but so you can take the meds to lower your cholesterol level. That'll work for a while, but it's not going to fix you. If you look at the number of people and all of the, what the geek term is comorbidities, meaning other things that you get because you're taking the medication, you see that people get really sick taking those medications with something else, that it's not the answer. It puts a lid on the pressure cooker for a while. And if you have high blood pressure, you take the medication, but you also find out, why do I have high blood pressure? Where's it coming from? And that's when you need a healthcare practitioner as part of your team to investigate with you, to really read the map of what's going on in your lifestyle that's contributing to this.
I love it. I like the word team, because that's the way it should be, some teamwork between the patient and the practitioner. We actually did a talk a few weeks ago about the barrier systems. And I know, you know, with your book, you discussed B4. Some people, they messaged me and they asked, I don't understand how, you know, like putting something in your stomach can cause brain symptoms. Could you talk a little bit about the systemic immune health and how it relates to brain health?
Sure. Mrs. Patient, your digestive tract is a tube, 20, 25 feet long, starts at the mouth, goes to the other end. It's a big, long tube, winds around in the center there, you know, but it's one tube. If you take a donut and you stretch a donut out, one big, long donut, and you look down the center of the donut, that's your digestive system. So when you swallow food, it's in the donut. It's not in your body yet, it's in the tube. And it's got to be digested, which means broken down. The scissors that break down neck like a pearl necklace. Scissors break down the pearl necklace. Snip, 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 snip. So the food proteins get broken down really small, smaller and smaller and smaller and smaller. That's digestion. The inside of the tube is lined with cheesecloth. And so when you swallow a bite of prime rib, those meat fibers can't get through the cheesecloth to get into your bloodstream. They've got to be broken down really small. Snip, 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 snip. Going further down the digestive tract until they're small enough to go right through the cheesecloth. Each pearl of the pearl necklace, if you will. Those are called amino acids. So all of our proteins, the proteins in all the food we eat, are like a pearl necklace. The acid in your stomach undoes the clasp of the pearl necklace. Now you got a string of pearls. And our enzymes are scissors to break them down until they're really small. Each pearl, the pearl necklace, goes right through the cheesecloth into the bloodstream. And that same kind of cheesecloth, it's smaller, but just like sandpaper has different grades of sandpaper, that same cheesecloth surrounds your brain. It's called the blood-brain barrier. And it's a much finer cheesecloth than the cheesecloth of your gut, but it's the same concept. Now, there are different foods that you eat that can tear the cheesecloth. And wheat is one of them, for example. Every human, every time they get exposed to wheat, when that wheat comes out of the stomach, it tears the cheesecloth in your intestines. Every human, every time. It's called transient intestinal permeability. Lots of studies on this. Just read the science, you know. But transient means it heals. Mrs. Patient, you have an entire new body every 7 years. Every cell in your body regenerates. Some cells are really fast, like the inside lining of your guts, every couple, 3 days. Some cells are really slow, like bone cells, but every cell heals. So you tear the lining of your gut. You eat a toast for breakfast, you tear the lining of the gut, transient intestinal permeability, but it heals. You have a sandwich for lunch, you tear the lining of the gut, but it heals. You have pasta for dinner, you tear the lining of the gut, but it heals. Croutons on your salad, tear the lining. A cookie, tear the lining. Flour in the soup base tears the lining, but it heals until one day you don't heal anymore. When you don't heal anymore, the term for that is loss of oral tolerance. When you lose oral tolerance, now larger molecules of the food in your tube, in your digestive tract, can get through the tears in the cheesecloth into the bloodstream before that food's been broken down small enough. That's why your intestines are 20, 25 feet long, because it takes a whole much longer time to break down prime rib than it does a banana, right? And so, but when you get tears in the cheesecloth, you lose tolerance to the food you're eating. And now these bigger molecules that haven't been snipped down small enough yet get through the tears in the cheesecloth into the bloodstream. They're called macromolecules, big molecules. And your immune system says, whoa, what's this? What's this on the highway? Because your bloodstream's just a highway. It's just lots of traffic on the highway. It's all going in the same direction, but there's no lanes of traffic. I mean, they're bouncing into each other as it's going in the same direction, but it's just a highway. But your immune system says, what's this, these macromolecules? This is not something I can use to build new bone cells or brain cells. I better fight this. And now you make antibodies to that food, like antibodies to wheat, or antibodies to tomato, or antibodies to chicken, or antibodies to whatever the food is that gets through the tears in the cheesecloth. Now those antibodies to the food are traveling in your bloodstream, firing their chemical bullets at the food molecules. Think of special forces with a high-powered rifle. They're going through the bloodstream and they're looking for that molecule that, let's say it's orange vest, that the macromolecules of chicken that the immune system says this is a problem. Let's say they're orange vests. So now you have special forces in the bloodstream bouncing around into everything, looking for orange vest, boom, bouncing around, orange vest, boom, firing their chemical bullets. Well, the inflammation that those chemical bullets cause tears the cheesecloth of your brain. So when you have inflammation in your bloodstream, you get tears in the cheesecloth of your brain. And the antibodies to fight wheat molecules specifically and dairy molecules specifically will also attack the cheesecloth of your brain because it looks very similar. And the geek word is molecular mimicry. But the antibodies to the food can attack your brain. Now you get tears in the cheesecloth of your brain. Now, remember, it was a much finer cheesecloth in the brain than in the gut, much, much smaller. So only the tiniest little molecules can get through. But now, bigger molecules that are okay in the bloodstream are not okay in the brain. They're not supposed to be there. Now, the immune system of the brain says, whoa, what's this? I better not let this in here. They're called glial cells, and they fire their chemical bullets. Now, these guys are not special forces. These guys have bazookas because nothing is supposed to get into the brain. So they fire their bazooka to kill whatever it is that got through the tears in the cheesecloth of the brain. It's a good thing. But the inflammation in your brain, in your bloodstream, keeps tearing the cheesecloth of the brain. You keep getting more normal molecules in the bloodstream that get into the brain that aren't supposed to. You keep activating glial cells, firing bazookas, boom, 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 boom. And you get what's called collateral damage. When you get the collateral damage in your brain tissue, now your immune system has to make antibodies to your brain tissue to get rid of the old and dying cells. Now you get antibodies to your brain tissue. Now you've got this whole cycle going that's constantly producing inflammation in the brain, constantly producing it, nonstop. And you don't feel when your body's making antibodies to your brain tissue. You can't feel it until you kill off so much tissue. Now you start having symptoms because the tissue's not quite working right. And you say things like, oh, I'm getting older. I don't remember the way I used to. Really, how old are you? Oh, I'm 38. No, that's not supposed to happen. There's something wrong here. But we accept it as getting old, or yeah, I'm just depressed, or yeah, it's the world out there doing it to me. You know, we try to make sense of what's going on, not understanding how to read the map, that the trigger is the inflammation in the gut, in this example, the inflammation in the gut causing tears in the cheesecloth of the gut, and these macromolecules get through into the bloodstream, and your immune system fights these macromolecules. So your doctor does a 90 food panel to see if you have food sensitivities. It comes back positive to 25 different foods. And you say, oh my God, that's everything I eat. Well, of course it is. Your immune system's trying to protect you. There's nothing wrong with your immune system. You have to heal the gut, heal the tears in the cheesecloth, right? So that whole mechanism just continues and continues and continues, because most of our healthcare practitioners don't understand this. And they think, oh, you got depression here, take this antidepressant. Well, just read the side effects of the antidepressant, right? So if you need it, you take it. Oh, your child's got attention deficit, here, give them Adderall. You know, why in the world do you ever give speed, which is what Adderall and Ritalin are, they're speed. Why do you give speed to a kid that's got a hyperactive brain? Anybody ever think about that? Well, wait a minute, this stuff is speed? Yeah, it's speed. Well, but my son functions better. Well, here's why. I had 13 cars in my undergraduate years that I owned. All of them cost $75 to $100.
You had 13 cars?
13 different cars in 4 years. I didn't have any money, you know, I was working my way through school. And so, you know, you buy a junker.
Oh, I thought you had a collection.
No. You know, you buy a junker, you know, for 75 bucks and you drive it till it dies.
Gotcha. Okay.
Many of those cars needed a tune-up. Well, that's a luxury that's not going to happen, right? Tune-up costs more than the car, right? So you drive them till they die. But, you know, you stop at a red light and a car that needs a tune-up really bad, it stalls at the red light. How do you stop a car from stalling at a red light?
I don't know. Keep the gas pedal on?
You put it in neutral and give it some gas.
That's right. That's happening.
You're revving the engine, right? And you're not hot rodding, you're just stopping the car from stalling at the red light. And then light turns green, you put it in drive, off you go. That's what's happening with attention deficit kids. Their brain is stalling at the red light. And so you give them speed, you rev up the engine, then they function closer to normal. So the question is, why is my son got slow EEG activity? Why is my son's brain running slow? Then you just Google gluten and slow EEG brainwaves. Here come the studies that in sensitive people, wheat can cause slow EEG brainwaves, not everyone, but in sensitive people. Mm-hmm. And the result is their brains don't work very well. And they have attention deficit. They're hyperactive because they can't sit still. They can't focus long enough to sit still. Well, when you rev their engine up a little bit, now they can think more properly and they can calm down their animal instincts and they function more normally. So every attention deficit kid that we've ever seen, in 40 years, the first thing we do, what foods is this body sensitive to? Mm-hmm. And the food might not make them sick. They don't throw up. They don't have stomach pains. They don't get diarrhea. So you never think it's a problem. But in celiac disease, the most common food-related disorder, we know that the ratio is 8 to 1. For every one person that has symptoms in their gut when they eat wheat, there are 8 that don't. Their symptoms are in their brain or in their joints or in their skin or in their liver or in their eyes, somewhere else, but not in their gut. So those people never know that when they eat wheat, they're throwing gasoline on the fire, causing more inflammation.
I think that's one of the scariest parts is, you know, when in your book, you also talk about silent autoimmunity and just the sneakiness of how these subtle immune responses can be. And then over time, you know, how they create these bad symptoms that we experience.
That's exactly right. That's exactly right.
The way I relate it to, like in the brain, especially with brain inflammation, neurons have to communicate with each other for efficiency and for speed. And when there's so much inflammation in the brain, it's almost like trying to have a conversation in a thunderstorm. They just can't do the job that they're supposed to do, or if they do, it's delayed, it's scrambled, it's
Right. That's exactly right. The inflammation inhibits neural communication. Really, really good visual.
yeah. So regarding immune health, you know, a lot of our followers on this page in particular have suffered traumatic brain injuries. Um, and our goal is really to try to just give people some good information, obviously avoiding uh, common allergens like gluten and any foods that you're allergic to. What could we do to help not only just boost our immune system, but also to increase our brain's immune health on a daily basis?
Yeah, well, that's a
And
really good question. But
just sorry, another shout out to your book. You give great little. I know I talked about this with our last chat, but these little Dr. Tom's tips. These are awesome. Like you know, because you read all the information and then it's like, all right, here's a little snippet to take away the next day. So, anyways,
right, right. Thank you for the
yeah,
feedback.
great idea.
Um, so your question is the question that everyone asks. What's something I can do for my depression? What's something I can do for my traumatic brain injury? Well, the first thing you have to do is find the right map and read the map as to how do you get to a better functioning brain. You have to read the map. Well, what map? What are you talking about? Where is the inflammation coming from? Because the long-term effects of traumatic brain injury are ongoing inflammation that's causing the problem. You know, if there's some physical damage, that's pretty obvious with the trauma, right? I mean, there's many tests that would identify that while you're still in the acute phase in the hospital. If you have a hematoma, a blood blister in your brain, or if you severed a nerve or something like that. You know, if there's anatomical damage, it's usually pretty obvious. So one of the complications with traumatic brain injury, I think now I'm not an expert on this one, but I've seen enough people with traumatic brain injuries and read enough papers to understand the primary map that has to be addressed is how do I reduce the inflammation in my brain? That's the big ticket takeaway. And that varies with the individual. Because if you're living in a moldy house, you know, and I'm going back to mold again, you're breathing it in, you're sucking it in, it's going right up to your brain, your immune system fights that. That's the gasoline on the fire for that person. That's why of the 5 different types of Alzheimer's, inhalation Alzheimer's is the #1 type, the most common type. It's because what we're breathing in our environments, or the diesel exhaust in the air pollution, or indoor air pollution. So I think the most important thing that someone suffering with symptoms from traumatic brain injury can do, the most important thing is to get on the journey to find out how do I reduce the inflammation in my brain. So the first step in that journey is to identify where is there inflammation in the brain. You got to see what's going on and have the biomarker, the temperature gauge on the dashboard, if you will. You know, there's 2 ways to measure the temperature in the engine of the car. In some cars, a hot light comes on. That hot light comes on, you're toast. Pull over, you're going to blow the engine. In other cars, there's a temperature gauge, and you can see it slowly start to climb before it gets into the red zone, right? So you want to identify the temperature gauges of brain inflammation before there's so much damage, the hot light comes on and you got symptoms. That's the hot light on the dashboard, is when you have symptoms that compromise your life because of traumatic brain injury, right? Mm-hmm. So you want to look at the temperature gauges so that you can figure out, what am I going to focus on? You have to figure out, where's the map? Or else, you know, you can shotgun in N-acetylcysteine, you can do IVs of glutathione, you know, you can do more lecithin, you know, you can do phosphatidylcholine, you can shotgun this stuff in. It's going to help. Of course it's going to help, but you still got the fire and the inflammation, you know, so you're going to take 1 step forward, 2 steps back, 3 steps forward, 2 steps back, 1 step forward, 4 steps back. And you're going to keep doing this dance because the fire is still going on in the brain. So the first step is to identify, where is there fire in the brain? Now, I'm so proud of this. My wife and I are actually in the house right now that we came to for our honeymoon a number of years ago, 4 years ago. And we were here for 6 weeks for our honeymoon, because I can be anywhere if I have good internet. And in that 6-week period, I read 93 research papers on the blood-brain barrier. 93. I was in heaven. My beautiful wife was sunbathing, loving where we are. We have great meals, and then I would just read my research. As a result of that, a test came out 8 months after our honeymoon called the NeuroZoomer Plus. And the NeuroZoomer Plus looks at 48 different markers, temperature gauges of fire in the brain. 48. And the accuracy of the test, this is going to be a little geeky, 97 to 99% sensitivity, 98 to 100% specificity, meaning it's right on the money every time, according to Mayo Clinic. So there's a blood test that you can do called the NeuroZoomer Plus. And you look at that, and if you've got traumatic brain injury, this test is going to come back and you're a mess. You're a mess. You know, people come to see me and they say, my favorite patients, I've been to Mayo Clinic and they don't know what's wrong. And I say, that's great. Oh, great, great. Welcome, welcome. And they look at me like I'm a nutcase. You know, they've already heard that, but I said, that means you don't have a disease. Because if you had a disease, Mayo Clinic would find it. Mm-hmm. You've got dysfunction. Let's see what's not functioning right. The tests we're going to do are not the same tests they did, because they've already demonstrated you don't have a disease. We're going to do functional tests to see what's not working right. And if it's your brain, every single person gets the Wheat Zoomer and the NeuroZoomer Plus. They get those 2 tests to start with, because that gives you so much information. So we do our tests for these patients and they go, oh, okay, functional test. And they come back for their second visit, you know, and everybody's nervous to hear test results. Everybody is. And they come back and they're sitting there and I'm looking at their test results and I say, well, this is good news. You're a mess. Look at this. You're a mess. And this is, well, this will take 2 months. This will take 6 months. This will just take 3 weeks or so. And we just go through everything on there. You got this and this and this and this. You want these tests to come back and show that you're a mess because you feel like a mess. And so you want tests that say, yeah, well, this certainly would contribute to it. This would contribute. Oh, yeah, this will contribute to it. So many people with traumatic brain injury will come back on a NeuroZoomer Plus and have 18, 22, 24 different markers that are out of balance. It's really bad. Mm-hmm. It's not good at all. But it's great to find it, because now you've got something to work with here. And you start your protocols, whatever your protocols are from a functional medicine perspective or complementary or integrative medicine, you start your protocol. 6 months later, you do the test again. Now the patient should be functioning better, but I want results here. I want to see the results. And it may come back the next time in 6 months and you got 12 markers out of balance. Say, oh, this is really good. You're still a mess, but half of the markers are back to normal now. And you've been functioning better sometimes. You have some relapses, but you're functioning better, right? So yeah, a lot better. Well, you still got 12 markers out of balance, but I feel so much better. Yeah, but if you stop now, all this crap is going to come back, most likely come back. We need to get this all normal because this is fire in the brain causing collateral damage. So that's the way you have to look at traumatic brain injury. You've got to find the map and then follow the guidelines of the map. You got mold antibodies in your brain, then what do you have to do? You got to get rid of the mold. Well, where's the mold? I don't know where your mold is, but let's find out. Get a mold remediator into your house and test the house. Or you may live in the woods and the leaves fall and decay and there's lots of mold in the air. You know, you check the air outside. You have to figure out where it's coming from. Well, what happens if it's the mold in the air? You get an air filter in your house or you move, one of the two. You know, see if you can still live there with an air filter in your house. I don't know. I'm not in charge of your lifestyle. I'm in charge of trying to figure out what's going on in your body. This is contributing to it. So here's how I know how to deal with it, right? Well, wait a minute. Can't I take something to feel better? No. You can't keep throwing gasoline on the fire and think that you're going to live a long and vital life.
Got to look upstream.
That's right.
Well, I think just knowing that alone is huge, that there are tests out there. And I, for one, did not know that the Neural Zoomer Plus was born on a honeymoon in Costa Rica. So thank you for that. And just for, we'll wrap this up in a sec, but for people watching, your website is chock full of information and those tests are available on your website, theDr.com. Is that correct?
That is correct. I always recommend people go to their healthcare practitioners and say, please order this test for me. And they likely won't know what it is, but it's an opportunity for them to learn, right? And if someone wants, you order the test with your doc and then you have a session with the doc and you with one of my team, our clinical consulting team, and they'll review the test for you, or the lab will review the test for the doc. Yeah. The doc doesn't want to look like he doesn't know something, he or she doesn't know something. So you have to be sensitive when you say, you know, doc, I've just heard about this test, and I know you might not be familiar with it, but I'd like to be the guinea pig. Could you order the test and we'll learn together about it? Well, there is no evidence. Of course there is evidence. You just haven't read it. You haven't read the evidence, you know? So people try to cover their ass because they don't want to look like a fool. Excuse me. But, you know, this is your life. You know, I'm not going to be politically correct when we're talking about your life. Traumatic brain injury patients are not functioning very well. And they keep going down the tunnel of what can I take? What can I take? That doesn't do it. You have to find out, how do I reduce the inflammation? Once you understand that inflammation is the fuel on the fire, once you understand that that's the mechanism causing your symptoms, the mechanism is inflammation wherever it's manifesting, then you understand you have to put the fire out. Stop treating the smoke, put the fire out.
Absolutely. I love it. Thank you. You know, the one thing too, people sometimes message me about is, hey, I've had these tests and I've been told nothing's wrong. That just means you haven't had
wrong test.
The right test. Yep. So,
right. And you know, we've got about 800 docs who have taken my course, my certified gluten-free practitioner course, and they all know, you know, that it's just that most docs haven't had the time to learn all this information. It's postgraduate information. It's not in the textbooks yet, although it's coming in the textbooks. I've authored chapters in a couple of Ivy League medical textbooks. So it's coming, but most docs just aren't familiar with this yet. So you have to be gentle with your doctor as you bring up the topic if you want them to order the test for you. And say, you know, let's learn together about this. Given that it's 97 to 99% sensitive and 98 to 100% specific, according to Mayo Clinic, that means it's right every single time, as long as the person has adequate total immunoglobulin levels. That's the only caveat. They have to have an immune system that's functioning normally enough to register the problem. As long as they have that, it's right every time. You can't argue with it.
It's awesome. Well, Dr. Tom, thank you so much for all of your information. We could pick your brain for hours, but I'll make sure to post the links to your website. And then also we do have a special gift for people watching, and I'll make sure to post a link for that as well. And I challenge you while you're in Costa Rica to read 94 articles this time. So we can all benefit from something amazing that you build out of that. I'm just kidding.
Thanks so much.
If I was in Costa Rica, I'd just be sitting on the beach. So thank you for all the work you do, and very grateful for everything I've learned from you in the past and in the future. So thank you.
Thanks, Dr. Brian. Really nice of you to say. Thank you.
Yes, sir. All right. Have a great day, and everyone, please hang tight or have a good one, and we'll catch up with you guys later.